for that kind introduction. Good evening, ladies and gentlemen. I've got a few jokes for you this evening. Please laugh, even if you don't find them funny. Something like that will do. I'll start off with a bit about last term. Last term I was on elderly medicine, and the great thing about telling jokes to old folk is they may not laugh, but they'll still piss themselves. Of course, old folk are always taught to be quite vigilant, which makes them a bit of a tough crowd. For example, knock knock jokes, they're an answer until you show them some ID. I used to work for a charity that took old people on day trips out. They sacked me though. Apparently, I was meant to bring them back. Of course, it's a worrying financial climate at the moment, I'm sure you'll all agree. And the old people are quite badly hit. Of course, many over 50s are failing to save. Do they not realise it's just Control S? Elderly medicine is a split rotation with psychiatry. And I was on psychiatry, and I saw one patient who tried to commit suicide 25 times. He said to me, "I'll finally succeed, even if it's the last thing I do." Another patient said to me, "My psychiatrist thinks I'm paranoid." He said, "He hasn't said so, but I know he's thinking it." I was in Churchill Square last weekend, and a woman came up to me and said, "Can you show me the quickest way to the hospital?" So I pushed her underneath the bus. Tim. Yeah? Femur, tibia, or fibula?
Tibia.
Tibia. Sorry, I didn't remember that a bone to pick with Tim.
Oh no.
Of course, sometimes when you're on the ward.
That was awful, mate.
Sorry. There's worse to come. Of course, sometimes when you're on the wards, patients ask you advice, and it can get a bit awkward. One patient said to me, "Should I take the blue pill, or should I take the red pill?" I said, "Just eat the fucking Smarties." I was in an outpatient clinic last week, and a young lady came in, and there was a kind of strange feeling in her abdomen. And
Go on, Jake.
the worst thing is they know what's coming. Right, a strange feeling in her abdomen. And the doctor ran through tests and said, "I think I know what's happening." He said, in a few months' time, you're going to need some nappies. The young lady said, "That's great news, I'm pregnant." The doctor said, No, you've got bowel cancer. Mixed reactions there. Of course, if you choose to tell jokes to other people, I feel you should be responsible. I had a friend who told that to his grandparents. Maybe not the best idea. I don't go around the neonatal wards telling dead baby jokes. I don't, it's alright. I was in another outpatient clinic, and a gentleman came in, and he came out, and he was looking rather sad. And his wife said to him, "What's the matter?" And he said, "The doctor said I've got to take one of these tablets every day the rest of my life." His wife said, "That's annoying, but I'm sure you'll survive." The man said, "That's not the problem. He's only given me 3 pills." Of course, we're all ill at some point in our life. Sam alluded to my illness earlier. I'm fine now, don't worry. Anyway, that's not a joke. I went to see my GP, and he ran a few tests and said, "I think I know what's wrong. I think you're a hypochondriac." I said, "Oh great, I've got that to worry about as well now." Sorry about this, just read on my hand.
Only one.
Always works in knowledge test. Recently I've had to start forwarding large quantities of post to the United States. Not because I know anyone there, just because it says, "To the occupier." Some of you may have seen me on telly. I've been on University Challenge and The Weakest Link. Quite famous. Wouldn't say I'm bigger than Jesus, but at least I'm real. I figured church and me don't really get on. When I first went, they tried to drown me. And then they got really annoyed when I took my car in for a service. Anyway, I'll soon be leaving you, please know. Just got one last joke left. It's quite quick.
Better be bloody good.
It's just, you've ruined it now, Sam. It's just a one-liner.